Good afternoon, everyone. We're just waiting for a few moments as all of our attendees are logging on, and there's quite a few of you. So we're just going to give you a couple of minutes and we will be starting very soon. Thanks for your patience. So good afternoon, everyone. I'm Gráinne Healy, Chair of the Sláintecare Citizen and Staff Engagement Forum, and I'm delighted to welcome you to today's webinar, the fourth Sláintecare Integration Fund webinar, part of our Learning Network event series. Today is the first webinar using the Zoom platform, which we hope you'll find more user-friendly. It is a platform which most of us, I think, by now are familiar with. As sometimes happens with these platforms, some of the videos that we will have for you today may move slightly out of sync in places. So apologies in advance for that, but overall, we're confident it won't take away too much from your viewing and listening experience. We are taking questions during the broadcast, and we will be making the questions and answers available to you after the webinar. So if asking a question or making a comment, please do indicate who the question is for, and we will make sure to get the answers for you. The Q&A button is at the bottom of the screen, and if you type in a question, that will come straight into me here for our attention. We are very happy to be delivering these webinars in conjunction with the HSE and the support of IFIC, the International Forum for Integrated Care. Sláintecare is, as you know, about providing right care in the right place and at the right time. In these webinars, you'll hear how the projects funded by the Sláintecare integration funds and some HSE funded work is showing us best practice for healthcare reform and showing how many have adapted work practices and created improved pathways while responding to COVID-19. This afternoon then, our focus is on eHealth, and we will be presenting various eHealth initiatives showing how they are supporting the delivery of Sláintecare, leading to improved pathways and better health outcomes. Before we go to the various projects, I am delighted to start this afternoon with a message from the Minister for Health, Mr. Stephen Donnelly, TD, who, on hearing about the webinars, wanted to speak directly to you, our viewers and attendees. Over to you, Mr. Donnelly.
Hello and welcome to the fourth Sláintecare Integration Fund Learning Network webinar. I wanted to record this welcome and personally thank you for your hard work and your dedication in improving our health and social care services for the benefit of patients all over Ireland. The programme for government was very clear about the future of Ireland's health and social care services. We want to accelerate Sláintecare. How do we do this? By bringing more health and care services into the community and into the home, by making more services more affordable, and critically by fast-tracking the essential eHealth programme. Moving care closer to the home is closely aligned with the work that you're all doing through the Sláintecare Integration Fund. The principle of delivering care closer to the home and the community has also been fundamental, as you know, to our response to COVID-19. COVID-19 has demonstrated not just the commitment and tireless dedication of our health and social care workforce, and this has been immeasurable, but it's also demonstrated the willingness and the eagerness of our staff and our systems to innovate and to adapt for the benefit of patients right across society. Many of the changes we've seen have embodied the core Sláintecare principle of delivering the right care in the right place at the right time, a service that is shaped around the patient rather than the other way around. Our big goal now is to harness this energy so that we reform our services for the long term. Of course, we will have to do this while we continue to manage the threat of COVID-19 and while we recommence the very wide range of non-COVID healthcare and community care services. This isn't easy, but if COVID-19 has shown us anything, it's that change can happen at speed when it is the right change happening at the right time and for the benefit of patients and service users. The Sláintecare Integration Fund Learning Network, which you are all part of today, is a huge part of that work. The projects that the Integration Fund supports have innovation at their core. I'm delighted that you're all coming together to learn from one another and share best practice. I hope you enjoy hearing from the various contributors through the day. Each project showcased today and in previous Learning Network events demonstrates the fantastic work being done around the system and is a fascinating insight into how services have adapted while continuing to innovate during this time of crisis. The particular theme of today's webinar, eHealth, is absolutely fundamental to how we will deliver services differently in the future. It's clear that the health service and patients have embraced technology and telehealth since the pandemic began. Technology is an essential tool in helping us bring care closer to the home and creating real efficiencies within the health service and for patients. We've made huge progress in this area during the pandemic, and we must learn from and build on this progress. I would like to thank you all again for the work you're doing to deliver Sláintecare and to ensure the people of Ireland receive the right care in the right place at the right time. I wish you all the best with your projects over the coming months, and I really look forward to hearing more about their impact. Thank you for everything you're doing, and I hope the webinar works really well for you.
Thank you, Minister Donnelly, for your support for our work and the implementation of Sláintecare. Before we begin our exploration of the various eHealth initiatives that we have for you today, I'm delighted to bring in Dr. Gillian O'Brien. Gillian is a member of the Sláintecare Implementation Advisory Council, and she will share her experience of eHealth developments, in particular as it relates to her work with the mental health organisation Jigsaw.
Good afternoon, Gillian, and thank you for joining our webinar this afternoon. As Director of Clinical Governance with Jigsaw, the mental health service that provides free, non-judgmental, confidential support services for young people aged 12 to 25, Jigsaw moved its services online during COVID-19. Perhaps you might start by just telling us a little bit about the work of Jigsaw.
Good afternoon, Grania. Yeah, I'm really pleased to join you and to speak a little bit about how we have had to adapt to meet the needs of young people during this unprecedented time. I guess there's two main ways in which we've adapted our service offering for young people. One is in terms of where our bricks and mortar services, where people came in for a face-to-face assessment and intervention. So what we've done is we now offer young people a choice of telephone, online or face-to-face service. So we're introducing that choice, which is really, really important. And what we find is some people are very open to moving online, others actually still want to wait and come in for face-to-face service. So we're introducing an element of flexibility, meeting young people's needs, quite person-centered, and we've gotten some really good feedback. And what we find is some people are very clear on which modality they prefer. And for others, it might be a blended approach. They might start out face-to-face and then they might move to online. So we're being very flexible with it, depending on the needs of that young person.
Very good. And I know you also provide workshops for parents, for example. So have you had to move them online also?
We have. We had actually begun to do that anyway before COVID because we wanted to reach a wider audience space. So we've just intensified that and really ramped up a bit more. So what we find is it means that we can bring, our mental health promotion messages to a much broader audience, and our numbers are much, much bigger that are engaging online, which is a really positive thing.
Great. And from the point of view of having switched to, as you say, the choice, but the digital delivery, what about the people who are providing the services, your clinicians, your staff? How are they finding the change?
To be honest, at the outset, they were a little apprehensive, understandably. This was new, it was a change, and they weren't quite sure how it would go. And we found that really dissipated as soon as they began delivering sessions online, because they saw that actually it's very much possible to build that therapeutic alliance online. Young people actually were engaging really well. And over time, many of the clinicians were surprised by how well the sessions were going, how much they enjoyed this type of work as well. So it really just needed people to kind of trust and to take a leap of faith. And it's been, I think the feedback from young people we collect, anonymous feedback, has really reinforced the clinicians that actually the value of the work hasn't been diminished by moving things online.
Okay, which is obviously very important. And then I guess in terms of the ease of connection for service users, they're not having to get the bus into town or travel or pay parking, all of the things that can sometimes be at worst an inconvenience and at most may actually put people off using the service. So Gillian, in the overall then, I mean, your role in Jigsaw, but you also, I think, have what I would call kind of a good helicopter view from being a member of the Sláintecare Implementation Advisory Committee. In your view, what's the future for eHealth initiatives and their part in Sláintecare reform?
Yes, Courtney, I think that eHealthcare initiatives will become acceptable and accepted form of service delivery. In fact, I think they'll become expected by people using our health and social care system because they've gotten a taste of them now. It's how the world has to work much more remotely. I think mental health care in particular lends itself very well to this mode of delivery. It's not for everyone, and it's not appropriate for every service user. But I think, as we found in Jigsaw, for example, and through the integration funding, we've launched a live chat and instant messaging service that really works well for young people because that's a modality they're very familiar with. And I also think that when we look at the objectives of Sláintecare, many of them can be really, I think, helped by eHealth care. So things like improving access, we know is a key objective of Sláintecare. And as you mentioned yourself there, going online removes things like transport barriers, etc., and cost, or local staff shortages. If things are centralised and done electronically, that removes that. I think accountability is really key in Sláintecare, wanting to make sure that what we're doing makes sense and is working well. And I know that certainly in our organisation, we've always had an electronic case management system and evaluation tools. So I see firsthand when you can gather data in real time, full reports, you can manage the information really, really well. I think capacity and demand, as we know, is a huge issue in the health service as well. And I think by moving some services online, it can be a more effective and efficient way of managing resources. Not everyone needs the same intensity and frequency of care. So this allows us to be a bit more tailored and a bit more person-centered. And also for staff, and I've certainly seen that in our experience in Jigsaw, that especially now that creches and schools have reopened, for those staff who are working at home, it affords them a level of flexibility and a more family-friendly way of working, which may go some way towards helping with recruitment and retention. Again, big issues for our health service. So I think in total, introducing and implementing widespread eHealth care will really help to put the patient or the person very much at the centre of health and social care, which is the bottom line in terms of Sláintecare.
Brilliant. Gillian, thanks so much for your time this afternoon. I really appreciate it, and keep up the good work in Jigsaw. Thank you very much.
Thanks, Gráinne.
So thank you, Gillian, as I say, for your work on the Sláintecare Implementation Advisory Council, but also your role ensuring that young people get the quality of service they need for their mental health in a way that meets their needs. Our first Integration Fund Showcase project this afternoon is actually two communications initiatives comprising a series of new eHealth citizen health guides and a digital signposting with information and supports for people with chronic conditions. Some 300 different online guides are being developed. Let's hear now from Ben Clooney, Head of Digital in the HSE, and some of his colleagues who are delivering these major communications integrated funds projects.
Hi, my name is Ben Clooney. I'm the Head of Digital in the HSE, and myself and my colleagues would like to talk to you about two of our projects that have been funded under the Sláintecare Integration Fund: Citizen Health Guides project and digital signposting, information and supports for people with chronic conditions. COVID-19 put a stop to our work on the Sláintecare Integration Fund project back in February, and we're only just now starting to reactivate those projects. As you can see here, the numbers of people who visit hse.ie and also the number of people that follow us on social, those have been growing really exponentially over the last 3 to 4 years. However, we weren't prepared for what we saw in coronavirus, and on 16th of March, as we moved into lockdown, we saw 1 million visits to hse.ie in a day, which was unheard of. So far this year, in the first 8 months, we've seen 38 million visits. In terms of queries on social, we've seen a change in behaviour from the public. During COVID, we've handled about 17,000 queries on social media. People are using all the channels to try and access information that they need to manage in COVID, to access testing, just to understand the answers to some quite complex questions. So I'd like to hand over to Brian and David to talk to you a little bit about the Citizen Health Guides.
Right now you have access to entire libraries of knowledge and information in the palm of your hand. But we're also in an era of fake news, so finding reliable information to inform our health choices and decisions can be difficult. Knowing what to trust can be impossible. Even good information from another country may not apply in our context. That's why I'm delighted that Sláintecare has supported the HSE to develop and publish updated digital health guides. Hundreds of individual pieces of information about health conditions, medicines and medical procedures, which are written for Irish patients, reviewed by Irish experts and published on the HSE website. Now people can have confidence that the information they are using to support their health and well-being is accurate and reliable, and Irish health professionals can recommend them to their patients.
Google is often our first port of call when we have some symptoms that we're experiencing, or we have a treatment that's been prescribed by a healthcare professional and want to get more information about our health or healthcare. So the aim of the online Citizen Health Guides project is to ensure that when people in Ireland do take out their smartphones or their laptops to look for health information, they're provided with accurate and accessible health information provided by the HSE and Sláintecare. And so they're really the two key elements of our content strategy, that all of our content provided by the Citizen Health Guides project must be accessible. So we write our content to a reading age of 11 to 14 years to make sure that as wide an audience as possible can read it and understand it. And we also have to make sure that it's easy to find through search and navigation. So when we produce it, we have to make sure that people can find it in order to get the benefit from it. And also we have to make sure that the content is accurate. So that's why we are working with a range of healthcare professionals, subject matter experts, who will fact check this content. These are clinicians working in Ireland who can make sure that the content is relevant to people in Ireland, and that it's maintained throughout the years with an active governance process. So this content will be a range of everything from allergies to X-ray, but there'll be a particular focus on chronic conditions and conditions related to pregnancy and child health. So in terms of work done so far, we've established a governance group with clinical expertise and expertise on it, and a governance charter that can support the maintenance of this project and the governance of this project in an ongoing way. We have a project plan and a content plan which maps out all of the pieces that we'll produce over the next 12 months. We have a content strategy and guides, including very clear workflows and processes. So with such a huge volume of content and so many people involved, we needed really clear workflows and processes to make sure that everything runs smoothly. And we've also been busy with the Coronavirus Health Guide, which consists of over 50 pages that have been iterated over 350 times as we've moved through the past 6 months. So keeping that up to date as evidence emerges, as the advice changes, and as user feedback comes through in terms of what's useful and what works for people, what people need to know. So work that's coming up next is the fact check of batch 1 of content, which was prepared prior to COVID. So that'll be going out for fact check with all of our subject matter experts across September and October. We'll also be preparing batch 2 so that we're ready to send that out for fact check in Q1 of 2021. And we're consulting with GPs through ICGP, so that'll be a piece of research where we link in with GPs to make sure that this guide works for them as well, because as much as it's for the general public, it should also be a useful tool for GPs, so that it's a resource that they can point their patients to during appointments, so that they have trustworthy information that they can rely on. And so just a few brief notes in comparison of old and new. I suppose the biggest change is that the old Health HSE had a huge audience. There was about 15 million page views on it over the years since it's been launched. So we know that there's a real need there, and we're going to continue to meet that need, but it's no longer fit for purpose and needs to be replaced. We also know that the old HSE website has been improved upon by the new HSE website. So by publishing to the new website, we benefit from all of the user experience and design improvements that have been made to that site, as well as having up-to-date content. So that's things like an integrated experience via the HSE digital roadmap, meaning that there's not a separate website that another user has to get to know, or a separate place where they go for this information. It's all integrated with the rest of our content and our information. It's a mobile first design. We know that the majority of our visitors are coming on mobile devices, so it will work for them. It's optimized for them. We also know that this site will be accessible, so we'll be meeting our accessibility requirements as part of the EU Web Accessibility Directive. And we also know that as this website is tested and improved, we'll benefit from all of those improvements that are made on a site-wide level. They'll also benefit the Citizen Health Guides. So we'll be starting with priority topics, the top 300 performing topics of the old Health A to Z. And we also have an improved governance process and structure in place. So that's a quick snapshot of the Citizen Health Guides project.
So to move on to the next project, digital signposting information and support for people with chronic conditions. This project has become even more important as we look for new ways of engaging with patients, getting the information and supports they need online rather than face-to-face. Peer-to-peer and expert support that was available in a face-to-face setting is now not available in a face-to-face setting due to coronavirus. A project like this is no longer a nice to have. It is critical to supporting people with chronic conditions. We'll be working with the clinical programs to develop comprehensive online guides for patients with chronic conditions and their families. These will be produced following the same principles that Brian spoke about earlier. A directory of services will be developed that will build on the work of the Self-Management Support Programme to provide up-to-date information about the support services that are available. And this work's already begun, again, working with the Office of the CIO to develop the necessary infrastructure and processes to deliver and maintain an online directory of public health services. The self-service messaging support programme will be developed by the dietitians working on this project that can guide patients from diagnosis through to structured patient education and on to embedding behaviour change in their day-to-day lives to manage and live with their conditions. Finally, we'll work with Margaret and Karen to develop a closed social media support group where people can access peer-to-peer support with expert guidance whilst they're taking part in structured patient education. Our timeframes have obviously had to be reworked, but we hope to publish the new guide to diabetes within the next 2 months. I'll hand over now to Marisa, who's going to talk to you a bit more about the use of closed social media support groups.
So we have a social media element to these projects for the chronic conditions and for the child health. We're going to develop an overarching social strategy for online support for people with chronic conditions and a separate one for people who are breastfeeding. I'm going to talk to you today about the chronic conditions one more specifically. So we will have a closed group for people with type 2 diabetes. The people in the group will be in attendance in a patient education program, and the social group will be additional support to those members. A closed group is a good way to get peer-to-peer support around a common topic, in this case type 2 diabetes. And they will be able to share their journey and their information, their experiences online, but they'll be able to do it in a private forum so they might be more comfortable in doing that. A senior dietitian will also be a member of the group to give everyone in the group more support and to give them additional support that they might need. She will be there to answer any queries the members may have, encourage them along the way, and correct any misinformation that may crop up in the group setting that sometimes happens from time to time on social media. We will have a dedicated content calendar that will be shared to the group over the course for the length of time that they're in it. This will be signed off in advance and tested to see how it will land with the group. In addition to the calendar, we will have lots of ad hoc content, like live videos where people can participate, add questions to the senior dietitian as she is giving the live video. Members will be able to get involved in that. We'll be able to do polls and sharing of interesting articles along the way. All of this with the main aim to keep the group engaged throughout the course. There are many groups already in existence online, but the benefits of this one, the real benefit of it will be that the healthcare expert will be there to support the members as they come to terms with getting used to living with diabetes. We have previous experience with closed groups for people who quit smoking. We ran a number of those a little while back. The groups were properly evaluated and the results showed that having peer-to-peer support as well as expert advice helped those to quit smoking. We have lots of learnings as part of that from that group that we will bring to the diabetes group and later on to the breastfeeding group.
Coronavirus has seen the use of technologies to support the delivery of healthcare move forward by at least 5 years, I'd say, within a very short period of about 6 months. We've seen new ways of working between clinicians and the digital team to deliver rapidly changing information to the public online. And we've seen what the resource requirements are to provide a 7-day-a-week quality service, and they are more significant than the resources that we had previously had allocated to us. We've also seen the demands of citizens change. As we saw at the start of the presentation, more people wanting to engage with the health service through social media, and literally millions of visits to hse.ie. The Office of the CIO have stepped up and provided leadership in driving the delivery of new critical information systems that would normally take 3 to 4 years to develop. Some great examples of how we can and have worked rapidly, collaboratively and transparently across the organisational silos in the public sector include the COVID Tracker app, a collaboration across government between the Office of the Government CIO in the Department of Public Expenditure and Reform, Department of Health, HSE, and Garda Síochána, Science Foundation Ireland, and some of the biggest tech companies in the world. The HSE, Department of Health, external providers are working together in a new way, focused on very specific goals and projects. This can be seen in the communications and messaging online with gov.ie, DOH and HSE working together to provide coordinated, aligned messaging through all channels. I suppose finally, if this isn't a demonstration of Sláintecare in action, I'm not sure what is. Thank you.
Ben, thank you so much for that presentation. And indeed, your final comment there, I think, is very strong, that your project is, in fact, Sláintecare in action. So perhaps, Ben, if you want to join us here, I have 1 or 2 questions, just kind of follow-up supplementaries. Having these information guides which support people making the right choices in a timely and effective manner is a key aspect of Sláintecare promise to deliver right care, right place, right time. How do these guides deliver on that promise in terms of information provision?
Hi, Grania. Thanks for that question. The guides are a really important element of the information on the website. And it's not just the guides. There's on the website, for every bit of information about a condition or an illness, we also try and present information about well-being, how people can live well with the condition, how they can manage the condition themselves, and also connections into services information. As part of these projects, there's also a service directory component. So we're trying to build directories of services so that we can give people the information about the condition, we can tell them how to manage it, and then we can signpost them on to services, whether they're in the acute setting in certain circumstances, but obviously as part of Sláintecare, we want to get care delivered as close to home as possible. So that might be community support groups, or it might be services in your local primary care centre. So it's about integrating all the information so that we can give people everything that they need in terms of managing their own healthcare.
Great, thanks, Ben. And there's interest coming in from viewers around making the overheads that you and your team had there, the information about making those available. So we'll certainly see if we can make those available for people, if that's okay with you.
Absolutely, no problem.
Great stuff. Okay, thanks, Ben. We get a chance to speak to you and your colleagues a little later in the webinar this afternoon. Thanks very much, Ben.
Thank you, Lynn.
Our second eHealth initiative this afternoon is a HSE-funded project called Attend Anywhere. And Attend Anywhere is a platform which allows clinicians to undertake secure video consultations. This initiative has never been more important, with the need for social distancing, keeping people safe at home, yet building pathways to enable access to medical services. We're now going to hear from Julie Bellew. Julie is the IT Deputy Delivery Director for Primary Care and National Virtual Health Team Lead with the HSE. Gillian will tell us more about Attend Anywhere, and also we'll hear some feedback from the patient experience of using this platform. Apologies in advance for some sync issues with this piece.
Hello, my name is Julie Bellew. I work in the Office of the CIO within the HSE, and I'm working on the rollout of Attend Anywhere, which is software to allow us to support video-enabled care. Thank you very much to Sláintecare for inviting us to this eHealth webinar, and I hope you find what we have to say interesting and useful. So while we're not Sláintecare funded just yet, we are very closely aligned to the aims of Sláintecare, and particularly to some of the action items. So our vision is to provide video-enabled care to support the delivery of both acute and community care closer to patients and families. I have a little video to show you. It's about 2 minutes long, and it should give you a real essence of the use of Attend Anywhere and what it looks and feels like. There are 2 small pauses, so I hope you bear with us, and I hope you enjoy it.
Video conferencing is an additional way for healthcare providers and their teams to have consultations with service users. The HSE are now using the video conferencing tool called Attend Anywhere. Attend Anywhere is a simple, safe and secure web-based platform that aims to mimic what happens in the real world by continuing to offer pre-arranged appointments, a designated waiting room and consulting room, but just done virtually. Attend Anywhere is currently being rolled out nationally.
Attend Anywhere has revolutionised the physiotherapy service in County Donegal. It has allowed us to remotely assess, treat and monitor patients with a variety of conditions such as spinal pain, Parkinson's disease and arthritis. We can see by video call how our patients are managing their condition at home and how they're getting on with their exercise programme. It is particularly beneficial for patients who have difficulties getting to our clinics because of mobility and transport issues.
Attend Anywhere technology is really easy to use and accessible for all ages.
The appointments are really flexible, it's comfortable to do in your own home, and you feel more comfortable in yourself talking to your physiotherapist. Because you are in your own home, you're not in a clinical setting, and I've really, really enjoyed it.
So thanks very much to our colleagues in CHO1 for allowing us to use that video. So that video focused on the physiotherapy service using it, but if you look at our lovely heart here, this is taken directly out of the system, and it shows all of the disciplines and all of the service areas that are using Attend Anywhere. It's everywhere from PHN nursing to speech and language to surgery and orthopedics, standard OPD in hospitals. So it's right across the care continuum. It's suitable for acute, for primary care, for mental health and social care. We can have routine appointments. We can have virtual clinics where patients are sent an invite to come into a virtual room, and when the therapist or clinician is ready for them, they will pull them into their private room. We can do virtual ward rounds with it. It gives remote access to patients and service users, which is really important when we're seeking to support physical distancing, and we really feel it's key for the resumption of services. This is some detail taken from the system as well of what we've achieved in 18 weeks. So the system went live on May Day. I hope that wasn't appropriate. And we can see here the number of clinicians here has risen steadily through May, June, July and August. A little dip in August, there's holiday time and so on. The number of calls, huge jump there from May to June to July. And again, a little dip in August. And we can see the hours are building all of the time, the hours of consultations. And indeed, at this point, we have enabled more than 30,000 virtual consultations. So that means that 30,000 people were able to see their clinician when they were having their appointment from the safety of their own home or from the workplace or wherever was convenient to them. I think this is really interesting as well, and it looks at the average call length. So we can see in May it was 15 minutes, and it's gradually risen up there, or steadily risen up. It's out around 30, 31 at the moment, and to me that's saying that our clinicians are building in confidence, and indeed our patients and clients are building their confidence in the use of video technology. I think we all are in lots of different ways. So what do our patients think about this? In general, the feedback is really, really good. It's easy to use. It gives me great reassurance that I'm doing my exercises correctly. It's really handy if it's difficult for me to get dressed to be able to go to my appointments. So we're getting some feedback around that it's so convenient. Maybe I have a long way to travel. So patients that are having to travel a long way for their primary care appointment, their mental health or their acute appointment and find parking and get in there, it's really made a huge difference to those patients. In places where services had to stop due to COVID, so for example in speech and language therapy, where some patients were regressing a little bit, this gave an early start back for some of those services, and indeed parents in particular absolutely delighted to see that move forward. For our clinicians, we've really good feedback from the clinicians, and this is used right across the full service. We've some of our favourites are up here if you'd like to take a look at them. You know, from an audiologist sending out a new hearing aid to a client, and they were able to show them how to fit the hearing aid and how to adjust it using Attend Anywhere. We have a CAMS consultant. So CAMS is Child and Adolescent Mental Health Services. She's found she actually can take 1/3 more clients in her outpatient clinic because it's less disruptive for the children and adults involved. They're more comfortable in their own home, and it's just easier all round. I have to give a shout to the public health nurses who have been absolutely phenomenal. They were some of the very earliest users. Mums and babies coming home from hospital were very nervous about letting anybody into the house, for their first visit. So the public health nurses started reaching out via video and, building reassurance, able to give those initial checks and building reassurance and building that relationship with the mums and babies. The CF clinic in Cork in particular, I think, needs a shout out. And this is where when a CF patient in Cork comes in for the review clinic, they see 5 different disciplines at the same time. So this was organised via Attend Anywhere, that they could see each of the 5 clinicians in one Attend Anywhere session. It's been quite complex and it has worked really well. So how do I get started? So if you feel this is for your service and you'd like to get going with it, if you look at the map here with all of the lovely stars on it, there are telehealth leads. If you'd like to contact them or come to us in virtualhealth@hse.ie and we'll point you, we'll let you know who your local lead is. There are 2 great resources available online on the HSE site and on eHealth Ireland as well. You'll get the links here, and there's a wealth of information up there. There's demos, there's training, there's lots of governance information and just good advice and lots of contacts. We really recommend that you map out how your service currently works. So draw it out and see who lets the patient know that to come in. It's most important that this is clinically suitable, and it's not clinically suitable everywhere. So make sure it's clinically suitable for your service. Work out how you're going to do it. We'll get you a license, get you up and running, test it, adjust it, test it again, and that'll get you started. I just want to give a major shout out. This is the team of people who are behind Attend Anywhere. From the middle of March, no stone has been left unturned in trying to make this available as quickly as possible. And I must also thank the Telehealth Steering Group, who have been a tower of strength and support to the project. Thank you so much, Sláintecare, for involving us in this webinar, and we look forward to the questions and answers.
Super, thank you, Julie. What an interesting initiative. Julie, you mentioned in your video the rising numbers of users and reaching over 30,000 video consultations in 4 months. That is some impressive number. But what, in your view, are the key challenges to rolling out Attend Anywhere for both the clinicians and for the users in switching to this eHealth initiative?
Thank you very much, Grania. Yes, look, we've had a wonderful response. Our clinicians have just been fantastic in taking up video-enabled care and seeing the role that it has within delivery of their service. I think the biggest challenge actually for clinicians, I think it's making the decision to go for it. And, seeking the support that is necessary to identify what changes do I need. I've been working this way for a very long time. What changes do I need to get this into my practice? And there's quite a bit to be done there. It's not a matter of just saying, oh yeah, we go with it, it'll be grand. So I think that's probably the single biggest challenge. There is great support out there. So for anybody who's thinking about it, there's super support available. We have those telehealth leads out right across the country. The national team will help. And I really have to call out the our nursing and midwifery colleagues. They have their own advisory group there. So there are 8 amazing people out on the ground who will go and work directly with them to make the changes required to get this up and running. We've all the challenges of trying to get the kit out there, so headsets and webcams and all of that. So there's great innovation going on around the place with respect to that. I think as well, Grania, understanding the space and the place where this fits. So a lot of our clinics have changed over, and a lot of care has changed over to phone rather than face, and that was a huge change to start with. So I think understanding the place where video is in between phone and actually face-to-face. So when the phone call isn't enough, video-enabled care can fit very nicely into the space, and just establishing that contact with our patients. I think they're probably the key challenges we see.
And Julie, one of our attendees, one of our listeners has asked, Anne Ging is asking, are there any indications that digital literacy issues are posing challenges for patients? And other viewers have wondered, are older people resistant or unable to access this? What's your feedback? What's your experience of that?
Well, we actually have 2 national surveys about to start, thanks to our NMPDU colleagues. One of those will focus at the clinicians. The other will also focus at our patients and service users, and will help us to address those issues to see, are people having difficulties? We're getting a lot of feedback because we had some use of video-enabled care before COVID came in. We had been working with colleagues on an Empower EU project, and we were starting to use a bit of video-enabled care. And I suppose focusing on digital disadvantage is a really key piece for us, and it's a part that we do want to explore, to understand, first of all, a lot of our elderly people are, well, we've a lot of silver surfers out there for sure, so we've a lot of people who are really good with their tablet and have access, but there's huge disadvantage out there as well, Grania. So we find a lot of time family will give a hand and come in and they're interested to do it. But we are trying to link in with we are linking with the broadband project. We're also linking with this CAUT Empower project to try to address social disadvantage. We're trying to get into the space perhaps of having eHealth hubs, somewhere that maybe if I don't have the equipment, could I go into my local health centre? Could I go to my library? Could I go in somewhere and be able to access the technology that saves me that 100-mile trip or 100-kilometre trip down the road to access care? So we are aware, but we're really interested in the survey and what we start finding, and that we try to address where the difficulties are. So it's very early days, but it's great response, and we're so interested in it.
Yeah, no, and there's huge interest online here from the questions coming in about just what you were speaking about, people having concerns about access to strong broadband, and the issue maybe of traveling to local hubs where you get a good broadband boost, even if you don't have it in your own home, and that might be only 2 or 3 miles away from you, rather than currently people are traveling great distances and finding that such a disadvantage. Julie, thank you. We'll come back to you again later in the webinar with some more questions as they come in for you. Thank you very much.
Thank you very much.
So now we're going to move on to something a little different, a virtual elective clinic for orthopedics. I had a conversation earlier with Dr. May Cleary about her initiative from Waterford.
So our third showcase eHealth initiative this afternoon is in the area of orthopedics. Dr. May Cleary is consultant orthopedic surgeon to the University Hospital Waterford and Kilcreen Regional Orthopedic Hospital. She's also the HSE lead clinician for the South-Southwest Hospital Group. May, you're very welcome. Thank you so much for joining us.
Thank you, Grania. No problem.
May, would you start off maybe telling us what is the problem that your project is seeking to solve?
Yes, well, Grania, in Waterford and in orthopedics specifically, we have a huge problem with our OPD elective waitlist. Patients, to put it into numbers for your patients referred by their GP, if they're deemed urgent, will have to wait approximately 18 months, so a year and a half for that appointment. And then if they're deemed routine, they can face a wait of up to 3 to 4 years. So clearly an unsatisfactory situation. I suppose Waterford services the southeast population, and it's a large catchment area in excess of 550,000. And our nearest neighbours and international recommendations would say we should have one orthopaedic surgeon to every 25,000 people in our population. Now, to put that in context, in Waterford, that would equate to 20 orthopaedic consultants, but in reality, there's only 9.5. So there's clearly a disconnect between supply and demand, and that makes things very difficult to just simply don't have the capacity to address the needs of our population in that traditional format. In terms of numbers, we see about, or have the capacity to see, just over 3,500 patients, new patients per year. But year on year, we're receiving 6,500 new referrals. So we're seeing that steady rise or increase in waiting list time. And this is pre-COVID. In COVID, of course, we've had a deficiency of new appointment slots that didn't happen, of approximately 1,200. And then with reduced distancing requirements, our capacity will be affected probably in the region of 1,000, so probably more like 2,500. It's just compounding what was already a difficult situation. In order to address this, or I'm looking to come up with some solutions, was really, as a department, we were looking to try and do things a little bit differently. And that brings us to the establishment really of the GP app, or this establishment or piloting of a virtual elective clinic. And really what this sets to solve is to allow GPs to access a specialist opinion virtually. Why we think this may be important is we know from previous work we've done on care pathways and with engagement with GPs that sometimes they refer patients for advice, and simply a referral to the outpatients is their only course of action available to them. And that if they had the potential for access to specialist opinion, then perhaps that patient or that referral could be avoided. We also know that over half, in excess of 50% of the patients, despite a very lengthy waiting period, when they do see us, they do not require surgery, and they're redirected to other modalities of treatment, such as additional, diagnostic imaging or community-based physiotherapy or pain management. So there is scope that some of these people could be seen or decanted in a different scenario if that was available to them. And that very much, I think, speaks to the ethos of Sláintecare around, the right care in the right place at the right time.
Great. So just talk a little bit about how the app actually works. Talk us through the mechanics of it.
Yeah, so basically the app is available to the GPs, or certainly once we pilot it, it'll be available to the GPs for use either on their phone or on a desktop. And, they have a very short, tight time frame for their patient consultation, so it must be intuitive, and it can't add to the, laborious in terms of a lot of typing. So it's very simply something that they can upload a picture or a voice note, so they can literally speak in and ask their question. And then we will receive that via an email, and then answer that within 24 or 48 hours. And that allows them, where appropriate, sometimes they will need to go on the waiting list and be seen by us, but for those that potentially may have another avenue available to them, such as community-based treatment, then they will be able to follow up with their patient within that week and potentially instigate that care pathway, very quickly.
Right, so in effect, people who in the past may have waited years just to have their case considered could, in a matter of days, actually have the advice they need and the care pathway laid out for them. So that would be an extraordinary benefit to the patient. But also, I think there are benefits to the GPs and the consultants, aren't there, May?
Yes, absolutely. I mean, definitely for the patients, for those subset of patients that's appropriate for, the commencement of care would be years quicker, quite literally, so long as the community services are available to instigate that treatment. But yes, for the GPs as well, of course, they are intensely frustrated, as you can imagine, by patients returning to them in pain, still on a waiting list. They have to, re-refer in again in order to try and expedite that appointment. But as you see, the supply is, the demand supply disconnect means that sometimes works and sometimes isn't. We just can't facilitate that. So for GPs to be able to rapidly, instigate treatment for their patients would be hugely beneficial. And then for the consultants, again, of course, we would love to see a reversal of the waiting list, or at the very least with this technology, a slowing of the incremental increase in the lists. And also it would allow us in our clinics to be more productive, because those patients that do require surgery and more urgent surgery are actually getting to us quicker.
Mm-hmm. So big wins all around, it would seem. I know you had to pause the project over the COVID period. I'm just wondering, as you continue to develop and pilot the app, what are your plans, say, for the rest of this year and into early 2021?
Yes, at the moment we're kind of fine-tuning the app, and within this month we are going to be doing mock referrals within the department, really just to troubleshoot it, with a view to piloting in 2 of the larger Waterford City GP practices in the coming months. And then based on our experience and their feedback, we may need to tweak it a little bit with a view to launching it to the GP practices in the region in 2021. So.
And am I right in thinking, May, that this application could have much wider applications than just in this field?
Yes, I mean, I don't think this problem, it's not limited to Waterford, and it's certainly not limited to orthopedics. I think this application has applicability nationally, or in any specialty, that has where GPs struggle to access specialist opinion in a timely manner. So yes, potentially it has much broader implications.
Super. May, thank you very much for your time this afternoon. Best of luck with the rest of.
So thanks, May, for that conversation that we had earlier. And I just wonder, May, yeah, there you are. Thank you very much for joining us live this afternoon. I know you're exceptionally busy. May, faster access to specialist advice and the reduction in waitlist times for patients, these are 2 key benefits of the virtual elective clinic in orthopedics. But in your view, in rolling out this app, what is needed to mainstream this as an eHealth initiative right across the country?
Yes, well, I suppose, Gráinne, the pilot will, produce data that will help us inform the sort of resource requirements to make this initiative sustainable and, more widespread. As I mentioned in our interview there, it's great for the subset of patients that may be appropriate to instigate their treatment into the community. But of course, if that's the case, and we recommend to the GP that they need some, further diagnostic imaging, or they need to access, rapid community physiotherapy, then those resources have to be available. So, it's clearly only one potential solution, but it's very much part of a much bigger piece. But I suppose that's why the pilot is small, at least initially, to kind of help see the traffic that will be ran across the app, to see, and there's a lot of auditing built into the system, so that we can look very closely at the percentage of referrals, or the percentage of GP queries that end up in an actual referral versus end up actually instigating their treatment into the community. And that will only not just, dictate the success of the project, but it'll also help inform, clear ideas around exact budgetary requirements to properly resource the community services as well.
Right, very good. So stay with us, May. We're going to go into kind of a panel discussion now, and I think there are other questions coming in around all of the projects that we have presented this afternoon. So our panel for our discussion is Ben Cloney, whom you heard from earlier on, Dr. David Hanlon, whom you also saw, and Marisa Ryan from the Digital Information and eHealth Information Projects. Also with us still is Julie Bellew from Attend Anywhere, and May, from whom you've just heard. So there are questions coming in, and I'm going to bring them to you, but I'd like to go back to Ben, if I could. First of all, Ben, a 5-year shift in 6 months is how you describe the leap in the use of eHealth tools. Now that, by any measurement, is some leap. How can we ensure that we bring everyone who needs to be included in using eHealth initiatives along? How do we address what people are writing into us here, and they're saying, there's a big digital divide, there's digital poverty, lots of people don't have broadband, how are people really going to, how do you address that? Because it is a big problem, isn't it, for information?
Absolutely, yeah. So I suppose we take a number of steps to make sure our information is as accessible as possible. This includes kind of testing everything that we do. So we test our information with the people that are going to be using it to make sure they understand it, that they can access it, they can find the information that they're looking for. And also we have an obligation under the European Accessibility Directive to make sure that our information is accessible using screen readers by people with a whole range of disabilities. So in terms of we make the information as accessible as possible. Obviously, as Julie was saying, there's a number of different initiatives that she's collaborating with to try and address some of the issues in terms of access to technology. We're also working with the COVID tracker app with Age Action Ireland to integrate it into some of the training programs that they run. So to try and broaden as much access as possible. And Marisa works with a number of community. There's a community digital training initiative which is run, and we try and develop kind of health information materials to be used in that. The broadband issue is a challenge which is beyond the scope of the HSE, and obviously there's the National Broadband Plan, and not the place to get into that here, but obviously we try, even with the app, we try to make it as accessible as possible on as many devices as possible, and we're working with Apple and Google to try and make it available on the kind of devices that older people might have, for instance. So it's a huge challenge, but we do have strategies to at least try to make the information as accessible as it possibly can be.
I mean, some of the suggestions, some of the questions that are coming in, Peter Walker wondering, have you been linking with NCBI, National Cancer Design? Those kinds of organizations really helpful, I'm sure.
NCBI actually did the accessibility testing on the COVID tracker app. So they tested it, and actually, we worked really hard to make the app work for people who have different needs. With the System Health Guides and HSE website, we're working with NDA and NCBI to make sure it's as accessible as possible, and to make the site load as quickly as possible. So we get rid of all the fluff and all the fancy stuff. And so the site, the site load should, the new site will load really quickly, so it doesn't eat up your data allowance on your phone. So there's lots of small things we can do to make it as easy as possible for people to access the information.
Thanks so much, Ben. Dr. Hanlon, could I come to you? David, you mentioned fake news in your piece, and heaven knows there isn't a day goes by that we don't hear about fake news, unfortunately, from very senior places on other parts of the continent. But how much of a challenge is fake news for those like yourself and your project, whose job it is to promote truthful health promoting information in a digital world?
Well, I suppose they're the competition, and so often they're clickbait, the kind of sensational health claim, or the mystery facts that will cure all your problems, and so much of it is driven by people who are either commercially driven or ideologically driven to try and promote a certain message. I suppose the other problem with what Google is very good at is finding what you're looking for. So if you're looking for some bizarre cause for a problem or some magic cure, they will know and they will find it for you. What it isn't very good is actually telling you what actually is reliable and what you can trust. And I suppose many people get used to just the first thing that pops up at the top of the screen, I'll take that. And often that's just compounding error. And if Google knows your demographics and your previous searches and the kind of things you're interested in, you'll get further and further into that mire of illogical and poor information. As a kind of fun fact, which may or may not be a fact, there are something like 1 billion searches daily on Google for health topics. So there's a huge appetite out there for it. And something like 7% of web content is health related. So there's an awful lot of it out there. And I suppose for anyone looking and consuming that, it's knowing, what do I trust? What do I believe? And of course, it's always easy to believe what you want to believe. And it's always easy to believe what's presented in a nice swish way, maybe by someone who's claiming to be a professor of something in some place, and you really don't know. So I suppose our challenge is to actually give people information that's accessible, that's relevant to Ireland, and using a trusted brand, and the HSE is a trusted brand for people, so they can actually see information and know that it actually is reliable, that it is relevant to them, that it's talking about things that are relevant to people here. So that's the challenge. But I say that we're competing against the clickbaits and the sensationalists, and
indeed,
that's Ben talked about making our site very presentable in terms of easy to access and cutting out the fluff. But some places like to do a lot of that sensation and the fluff and the graphics, and that's very superficially draw people into things.
Indeed. Marisa, can I come to you? There's a lot of interest in your presentation, questions around, are there plans to extend closed social media groups? My own question for you was around the concept of closed social media support groups. I think it's a fascinating one. And you mentioned that it has had proven success in, for example, the quit smoking groups. So people who share a condition or share an experience, being able to help and support each other. What are the challenges in setting up these groups? And most importantly, or just as importantly, keeping the momentum of them going?
So we set up the closed Facebook group and a little while ago because there was so many changes happening on Facebook, and kind of the algorithm had changed so often that people weren't seeing the content that they wanted to see, and they were seeing a lot of advertising. So they had kind of prioritized closed groups, and we suggested we would do something for people who wanted to quit smoking. And it was like that they were attending a group, and time is of the essence, and they can't actually physically attend a group, so they did it online. But the groups that we've set up to date, it's that we want to ensure that they're invited to the group. They can opt out at any stage, that they don't have to go in. Like, we're not forcing anybody to be in the group as part of that, and we want to keep that going. We have learned a lot from the smoking group that engagement is absolutely key. You want people to continue to have the conversation online, and that's why it has to be two ways. It has to be from our side and from the people in the group to keep it engaged. And that's why there's lots of things you can do in these groups to keep them going and keep them kind of interested in it. And as David mentioned, fake news is such a thing as well. It's so important that the information that we give them is factually correct, and it's from a dedicated health professional, that it's not just saying, I heard something on this. And with us being part of the group and the healthcare professionals part of the group, you have that, you can stop any fake news that happens as it happens along with it. It's quite important for that for us.
And one of the other questions Patricia Davis was asking, are there plans to extend this to other chronic diseases? She wonders, for example, about COPD and asthma.
Yeah, so we're starting with type 2, just that, and we want to create or get a proof of concept around that, just to ensure that it is the right thing to do, and people benefit from having the healthcare professional in the group. And just to move that forward, we want to prove that it is the right thing to do first of all, and have kind of like a little bit of an evaluation as part of it, and just that people will know it's the right thing.
And one person's just wondering, can the members of the closed support group, can they interact with each other, or is it just the medical? They can. Okay, so it's
that was one of the
self-help and
interaction. We saw from one of the closed Facebook groups for people quitting smoking is that they encouraged each other. Like, a lot of the conversation happened amongst themselves, and the healthcare professional could get involved as the conversation was going, but a lot of that was happening amongst themselves, and that was the most successful closed group, when they spoke to each other and gave each other the peer support that you look for.
That's the strength of them, really, isn't it? Yeah, great. Thanks, Marisa. Julie, can I come back to you? There's a question coming in wondering, from your perspective, what are the top 2 lessons learned for Attend Anywhere?
I think that's such a great question. Lesson number 1 is assume nothing. We learned that very, very early.
Great.
You might be all ready with your kit and everything, but has anybody actually told the patient or service user that it is going to be a video call? So we really did absolutely nothing. So there's a good bit of support required there, and the second big thing that we would say, don't let things hold you back. Don't let a want for a license or for technology hold you back. That's not the first thing to do. The first thing is to think, is it suitable for my service, and how can I go about it? And then come, and we will do everything we can do to help you. Don't let those things hold you back. I think a lot of the time, through fear, and it's fear of change, and we're all a bit fearful around these different ways of working. it can be the excuse sometimes, well, I haven't got the headset. You know, so don't let that be the thing that holds you back. I think they're the two key ones.
Great, thank you. And again, in terms of attend anywhere, the idea of, are there plans, Stephen Bradish is wondering, are there plans for attend anywhere to support group delivery of services? For example, physiotherapy, he asks about particularly.
So I think groups fall into two different places. We have been using Attend Anywhere for groups. Actually, before COVID came along in Drogheda, we were delivering pulmonary rehab exercise classes out to groups in the community. And one of the great benefits of that is that some of the partners and family members were joining in with the exercises for an added benefit. So yes, we can support up to five or six. So it's a very small group. This is really a very clinically aligned tool that we have. For groups beyond that, we're recommending WebEx. I was actually just answering a question there on that. So we're recommending WebEx. Please come to the virtual site, the sites that are there on HSE. You can find out more information there, or contact us and we will point you and signpost you in the right direction. So from our perspective, WebEx for large groups, Attend Anywhere for one-to-one or groups up to 5 or 6.
Okay, that's excellent. One of the questions that came in actually wondering about, is WebEx a more appropriate platform for you? Super. May, can I just go back to you, if I could, a question again from an attendee. What is the impact for patients in particular? I suppose it's about explicating this in some way, of the shortening of wait lists. I mean, when we spoke, you were talking about really unbelievably long wait lists. So for the patient, if we can shorten these wait lists, what kinds of outcomes are you seeing when your app works and the wait lists get shortened and people get the specialist consultancies that they so need?
Yes, well, I suppose, Gráinne, it's still aspirational, but if we believe the dream, I guess the subset of patients, I mean, it won't be everybody. There will be people who will still obviously have to go on the waiting list, but if we can decant a proportion of them appropriately, that means that, you know, the effects for them could be potentially profound. Their GP within the week could have instigated their care pathway rather than them waiting perhaps 3 to 4 years even. So, I mean, that's a potentially huge effect. But I suppose also for us, you know, the person who genuinely needs urgent surgery, because I said, you know, over half of the people who do attend us don't go the surgical route straight away.
Yeah.
So what happens then is potentially we're distilling down the referrals that are coming into us, so that the people who are really in need of urgent surgery get to see us sooner and get their surgery sooner. So it has implications on both sides of it. So, and that's fantastic. Obviously, the longer people wait who are in dire need, they potentially can't work, maybe can't mobilize, they become housebound, and all of the, you know, psychosocial implications of that while they languish on a waiting list. Notwithstanding that, but their comorbidities potentially go up because they can't mobilize, they become obese, you know, so their potential post-operative complications come up. So there really is far-reaching implications of getting to the surgical group faster. But of course, that's always the challenge. But this is one method that I think potentially can help achieve that.
Great, super, thank you. And those benefits are incredible. Okay, we are coming towards the end of our time this afternoon. I want to thank all of our guests here today. I want to thank Minister Stephen Donnelly, TD, for joining us earlier on, Dr. Gillian O'Brien, Ben Cloney, who stayed with us for the afternoon, with Julie Bellew, Dr. May Cleary, Dr. David Hanlon, Marissa Ryan, and Brian Malone, who was with us earlier on. Our next webinar is planned for Thursday, 22nd of October from 3:30 to 5. And our theme on that day will be examining health and well-being. So put that date in your diary and do join us again to see how so many HSE frontline workers, Department of Health staff, in partnership with local community groups and health and service providers across the country, are making changes to improve health and care services for all of us. As part of Sláintecare, delivering right care in the right place, at the right time, by the right team. Meanwhile, thank you to all of the team here involved in the production of this session: Rosaline Harlan, Muriel Farrell, Lindsay Dray, Ingrid Doyle, Erica Kinsella, Suzanne Lynch, Andrew Hannigan, and Tom Jukes. If you are involved in a project which is promoting integrated care, please get in touch with us by email on sláintecare@health.gov.ie. You can watch this webinar back or recommend it to your colleagues. It will be available on the Sláintecare website, and do send us your feedback. The questions we didn't get to answer in the webinar, we hope will be posted for you in the coming days. So from me, Gráinne Healy, stay safe, wash hands, and please do hold firm as Sláintecare continues to deliver on its promise of a health and care system that ensures we all have the right care in the right place at the right time. To close out this afternoon, we are delighted to have Laura McGahey, Executive Director of Sláintecare, to say a few words.
Hello everybody, it's a great pleasure to be here today and to have listened actively in today's session, and it was incredibly interesting to hear the role that technology and eHealth is already playing in changing how things are delivered for the better for the patients that everybody sees. I'd like to thank Minister Donnelly for taking the time to give us a message of support. And just to say that I think in reflecting on what I heard today and the opportunity that the COVID-19 pandemic has offered in promoting and promulgating eHealth, it really has led to unprecedented interruption to our normal healthcare activity, with both community and acute settings affected. And there are important lessons that can be learned from COVID-19 and applied to the ongoing implementation of Sláintecare throughout the service. In particular, the important role of technology in delivering care, including teleconsultations, video consultations, e-prescribing, e-referrals, virtual clinics, and remote delivery of care, rehabilitation and reablement programs, all of which have considerable potential to safely deliver care in the prevailing high-risk environment. Many of the innovations implemented in response to COVID-19 were aligned with the spirit of the Sláintecare report, focusing on providing universal care that people needed when they needed it, encouraging greater levels of prevention and self-care, and the rapid deployment of technology to deliver appropriate care in community and home settings. Our presenters today, Gillian, Ben and his team, Julie, May, and the presenters as well, panelists, have all described their projects and how these projects will ensure we are delivering the right care in the right place at the right time. Over the previous webinars, we've heard from many other projects which have had to change their delivery model due to COVID-19, and their focus is on managing as much care as possible in the community through the rapid deployment of eHealth solutions. The agile and creative response to the unprecedented challenges faced by you in the delivery of services to the public is a credit to you all. Thank you again to everyone, and I look forward to our next webinar, which will take place, as Gráinne has said, on Thursday, 22nd of October. Thanks again.